I will speak today about the second session of diabetics and orthopedic disease, which is what's called the frozen shoulder or adhesive capsulitis. Before going through the adhesive capsulitis, we have to know some anatomy about the shoulder. We have in the shoulder joints two bones, which is very important. The first one is the scapula, and this is the anterior part, this is the posterior part. And we have the glenoid. This glenoid, which lying the head of the humerus, like in this situation. This is the lying the head of the humerus. We have this joint have a wide range of motion and to allow the movement in all directions. And this considered to be one of the highly mobile joints of the body. The support of these joints depends on the ligaments and the tendons attached to the proximal humerus, and also the capsule. The capsule is a sheath which is lying directly over the bone, attached to the edges of the bone here of the proximal humerus and the glenoid, and over it lying the tendons. This capsule allowing the wide range of motions. When inflammation happens in frozen shoulder, this capsule becomes shrinkage. And the shrinkage of this capsule leads to the limited motion of the shoulder in all directions. That's why the frozen shoulder is the primary disease which occurring in the capsule of the joint. I will speak today about the frozen shoulder. Frozen shoulder, also called adhesive capsulitis. This is one of the diseases which is most commonly seen in diabetics, less common the non-diabetics. We have stages for the frozen shoulder. The first stage is the freezing stage, at which there is too much inflammation, as we see in this photo, and too much inflammation in the capsule of the joints, which leads to limited movement because of the severe pain in the joints. Not due to the stiffness, not yet the stiffness happened. When we examine the patient in this stage, we have already, when I try to move the shoulder, it's moving with me, but it's very painful, but not yet stiff up till now. And this may reach up to 2 to 3 months. The second stage, which is called the frozen stage, the pain subsides too much. And the obvious pictures in these situations is the stiffness. So the patient's coming with little pain, but the stiffness is too much obvious. And this may reach up to 6 months. The third stage, which is called the thawing stage, this is resolutions of the stiffness, and the pain becomes subsides gradually with time. It may reach up to years. And we have to catch the patients as early as possible to prevent stiffness. Because if the stiffness happens, the muscles becomes weak, and gaining the range of motions of the shoulder will come with time, but the problem is the weakness of the joint after this one. In the first stage, which is associated with severe pain of the shoulder, with limited the active range of motion of the shoulder, it's better to take non-steroidal anti-inflammatory medications. Then we are trying, of course, the physiotherapy is very important in this stage, and sometimes you are injecting the joint with steroids. These steroids will reduce the inflammation and help to subside the pain, and help to the physiotherapist to get the range of motion for the shoulder. As we see here in the first exercises is the pendulum exercise. We are doing range of motion exercises with pendulum movement in all directions. First extension, flexion, then circumvallum motion all around. Then we will start the next exercise, which is the wall creeping exercise or finger wall motion, as we put a paper a paper on the wall and try to move up and down like this. Each exercise we are doing twice daily. Every time we are doing 10 times. We are trying to move the shoulder in all directions. The third one, which is the stick exercise, external rotation or internal rotation of the shoulders with the movement or help of the other hand. As we see here, the stiffness is in one hand. We are pushing with the stick to the right side, then we are pushing to the left side. Try to move the shoulder in external and internal rotations, and this will help to cut any fibrosis or stiffness occurring in these directions. 10 times, twice a day. If you neglected this stage, you will pass to the second stage, which is called the frozen stage, at which the shoulder joint is stiff but little pain. In this situation, the injection of steroids is less helpful, but it may reduce the further stiffness for the shoulder. But we have to go to the second stage, which is the physiotherapy. We send the patient for physiotherapy. He has to get aggressive physiotherapy. This will lead to gain some motions. If this failed to gain the motion and still pain, we will go through the next step for the treatment with either of two. The first one is the manipulation of the shoulder under anesthesia. And these manipulations will give only a better result in 50% of the patients, but we have 50% recurrence rate. And sometimes from the start, we are going through the arthroscopic release of the capsule. We're going, as we said in the previous session, which is the rotator cuff tendinitis. We are doing shoulder scope to repair the tendons. We are doing shoulder scope, but only to cut the fibrous tissues, which is making adhesions inside the joints. Cutting of the fibrous tissues, and we are seeing also the tendons, maybe have some tear, some inflammation, we are treating in the same time. This is, of course, if manipulations or shoulder scope, followed by aggressive physiotherapy and for a long period, because we don't want the joint to come back to the stiffness stage. If you did the surgery and you neglect the post-operative rehabilitation or exercises, you may come back to the stiffness again. That's why physiotherapy is very important after surgery with steroid injection. In the third stage, which is the sewing stage, is a long-standing recovery for the joints, and it may reach, as I said before, to 2 years. I hope this information is helpful for you. And if you have stiffness of the shoulder, starting of stiffness and severe pain, not responding to medication and physiotherapy, you have to visit your doctor, who will prescribe for you injection, physiotherapy, or manipulation under anesthesia, or shoulder arthroscopic release of the capsule. Thank you, and I will see you in the next